Marie is an incredible individual. She's quite young. She's in her 30s. She required her first transplant as a child, and that lasted her many years. She went on to need a second transplant that unfortunately she lost relatively quickly. And what that did was left her highly sensitized based on the prior 2 transplants she had, and also the need over the years for several blood transfusions. Both of those things contributed to her level of sensitization. Anne Marie presented with a potential living donor to which she was highly sensitized to, in which desensitization would not even be an option because the level of incompatibility was so strong that even our current desensitization options would not have worked. And so we entered her and her donor into our database, and what we were able to find was a perfect tissue match for Anne Marie, but a blood group incompatible transplant. And so Anne Marie participated in a paired exchange that involved a swap, but also involved her undergoing desensitization such that we could cross the blood group barrier. The other thing that made Anne Marie challenging is that she had already had 2 prior transplants, and so from a technical standpoint, her operation was more challenging than a typical kidney because the 2 spots we normally use were already taken by prior transplants. And so she had to have a much more extensive operation in which her kidney was actually placed inside her abdomen through a midline incision and was inserted on her vena cava and her common iliac artery, as opposed to the typical location, which is a bit lower down and easier to access on the external iliac system. So it was a bigger operation for her, but ultimately I think for her has been extremely beneficial. This is a young woman who now has a normal creatinine at 1.2 and has her life back and will be off dialysis and be able to go out there and live the life that she's hoped to do.